This is a cesarean section. A cesarean section, or C-section, is a surgical procedure in which an incision is made in the woman's abdomen and uterus for the birth of a baby. Although some cesarean sections are planned, sometimes the need for the procedure presents itself once labor begins. If abnormal conditions occur during labor that make a vaginal delivery unsafe for the mother or her baby, doctors immediately resort to a cesarean section. Common reasons for cesarean delivery are dystocia, occurs when the baby's head is too large to pass through the birth canal, or his body is in a position that could be dangerous for birth. Many times, the position of the fetus is perpendicular to the birth canal, or with the baby's buttocks first, that is, in a breech position. Placenta previa occurs when the baby's placenta completely or partially obstructs the cervix mother's uterus. Fetal distress. This occurs whenever the baby's health is in danger, usually due to inadequate blood flow through the placenta or umbilical cord. It can also occur when the placenta separates from the wall of the uterus before swallowing. That is, the baby feeds on amniotic fluid and placenta that is attached to the uterine wall. Or when the umbilical cord is compressed or is tightened. This state alters the fetal physiology before or during delivery, so the baby is at risk of losing his life or suffering permanent injuries if not treated in time. Other causes that may require a C-section include multiple births, that is, the birth of twins, triplets, etc., large tumors in the uterus, genital herpes or other infections, diseases such as uncontrolled diabetes or hypertension. The doctor may use ultrasound tests and a fetal heart monitor to help decide whether or not the baby should be delivered by cesarean section. In the event that a cesarean section is necessary, the mother is prepared for the surgery. If it is not already in place, an IV will be started and a catheter inserted into her bladder to drain urine. Once ready, anesthesia will be administered in the operating room. In most cases, spinal anesthesia is applied to numb the lower part of the body. Occasionally, general anesthesia will be used. During the procedure, the doctor will start by making an incision in your abdomen. This can be a vertical incision that goes below the navel to the top of the pubic bone, or more often, a horizontal incision and just above the pubic bone. This type of incision is called a bikini cut. Subsequently, the doctor will make a second incision in the lower part of the uterus, and once it is open, if the amniotic sac is still intact, he will break it so that it is possible for the woman to give birth to the baby. Generally, the time from the initial abdominal incision to delivery is usually 5 minutes. Your doctor will then clamp and cut the baby's umbilical cord to gently remove the placenta. Finally, the doctor will take care of firmly suturing the uterus and abdomen, a process that usually lasts 45 minutes. The hospital stay after a C-section is usually 3 to 5 days. During this time, the woman will be advised to nap when the baby sleeps and to get out of bed frequently. As anticipated, most patients are able to care for their new babies shortly after the procedure. Full recovery may take 6 to 8 weeks, and the C-section scar will gradually lighten as it heals.